Welcome to the CodeCast podcast. Real-world insights for your daily medical coding and billing processes. And now, here's your host, Terry Fletcher.
Hello, everyone, and welcome to the CodeCast podcast today. My name is Terry Fletcher. I'd like to say Happy Mother's Day to all the mothers, grandmothers, stepmoms, anyone who is an acting mom out there, furry pups and pet moms, all of you. So hopefully you had a good weekend and you're ready to start the week. So one of the things that I've noticed in my podcast lately is I seem to be commenting or at least talking about some of the elements of the E&M services, evaluation and management. And the reason is because there's a lot of confusion when there's giving credit where credit's due and not over or under coding or underscoring what a provider is doing, as long as it's well documented. Now, I also see some grids out there. When I talk about the grids, they're like the audit grids that have the three elements. AMA has one. It's a tool they use. And I've retooled mine as well, just so I can read it a little bit easier, because theirs was a little hard to read. But I've noticed that some people are adding things to those grids that have no basis and calling them AMA tools. So be careful with that. There's a company I actually respect out there that did that when it came to a referral to a specialist, which I will cover in another podcast, what level that is, and they're wrong. So I was like, oh my gosh, and even AMA said, who did this? And I'm like, it wasn't me. So you have to be very careful and look and see where something came from. I always put my logo on anything from Terry Fletcher Consulting. And when you see a logo that isn't American Medical Association or isn't CPT registered trademark, then you want to make sure you know whoever it did come from, that they can back up where they're getting their information, because it could come back to bite you later, and we don't want that to happen. So one of the elements under data is a question that comes up quite a bit. And it says, this is the question that I get a lot. Can a practitioner get credit for both ordering and interpreting of a test if documented? So, and there was a change in 2023 related to this. Now, I've talked before about if you order a test and you're giving a result of a test, that you can't get both of those, because on page 8 of the 2025 CPT book, and it's said this since 2021, but it says, ordering a test is included in the category of test result or results, and the review of a test result is part of the encounter and not a subsequent encounter. So that's where you have to be very careful. If you're ordering a test, and let's say you're ordering an x-ray and you give a paper result, then you have to be careful not to charge for what they call an interpretation. Now, an interpretation is different. And it also comes with a different level in the data element for an E&M. So you're still in category 1 under ordering or review of a test when you're looking to pick for that category. But when you're looking at interpretation, and it's called independent interpretation, it now could bump you up to category 2 in the moderate data element. And this is important because, that, kind of comes with an extra $50 to $80 reimbursement. Could be a higher copay for the patient, could be a higher out-of-pocket for the patient. And we don't want to be not only forcing the issue with increasing the patient's out-of-pocket, increasing what the payer is going to see from you if it's not appropriate. So what does it mean to be able to get credit for ordering and an interpretation of the test? So in March 2023, CPT issued an Errata and technical corrections, and it added one line to the section on independent interpretations. And the changes in the printed copy of 2024, and of course it was in the 2025 CPT book. And it reads, a test that is ordered and independently interpreted may count as both the test as a test ordered and interpreted. But let's talk again about what does that independent interpretation mean? So an independent interpretation is credited when a physician or other healthcare professional views an image or tracing and uses that information for clinical decisions. It's not just to read a report or to review a report with the patient. The practitioner, so physician or the qualified healthcare provider, anybody who can bill the E&M directly, they document their interpretation. And the other physician, usually a radiologist, they were already paid for their formal interpretation. So you're not billing another interpretation. You're basically, or they've billed the global. But the test has to have, first of all, a report, but you're not just giving that report review. The test has to have a professional and technical component. That's why we're first looking for that report. And then the physician can receive credit for an independent interpretation only if they or their same specialty partner didn't bill globally for the service or for the professional component of the interpretation. So if a surgeon views an ultrasound or a CT scan that a radiologist has or will formally review into an actual report, and the surgeon documents those findings with how that will impact their treatment, then they could get credit for independent interpretation for the surgeon at the E&M visit, which because the image was viewed, interpreted, and documented to the patient. So independent interpretation also means you're giving that information to the patient. Because sometimes, you'll order something that you don't do in your office. You don't do MRIs, you don't do CT scans, you don't do ultrasounds, whatever. And so you'll send them out to the radiologist. Okay, I know I've had a CT scan done. And then they basically okay, your doctor will tell you how it goes. And unfortunately, they still bill the global, or at least if it's done at the hospital, they bill the technical. And the radiologist still has to generate a report. And so it does have a technical and professional component. But the question about the change in 2023, can the provider get credit for both the interpretation and the ordering? The answer is yes, but again, you have to make sure that let's say in this scenario, the surgeon was looking specifically at the films of the CT scan, which now they can pull that up on their computer. Usually most practices, specialty practices, have access to the hospital EMR. Even if they've ordered the CT scan and the radiologist billed for the interpretation, they can get credit, again, if they're looking at the film to go over that with the patient. Now, if an orthopedist views an x-ray taken at their own practice, a couple of months ago or even years ago, usually that's billed globally at the practice, and that does not qualify as an independent interpretation because their same specialty partner, or even possibly them, did the professional interpretation and they billed globally in the office, so it was already billed and they already got credit for it. They couldn't even go back and get credit to review it because they already got it. That's one thing I'm noticing with some of the data points. I actually did an audit for a payer recently, and we did an interesting take on this where, first of all, we did want to see that when it was coming to the independent interpretation, that there was evidence and documentation that reflect that the provider was doing an independent interpretation on either the film, the specimen, the actual pathology of what they were looking at. So it had to be the image. But the other thing, and a lot of times it wasn't, they were just, again, reviewing a report, and that's not an independent interpretation. That's double dipping from what a radiologist already did. But the other thing that it has to do is it has to link to your medical decision making. That's why you're doing an independent interpretation, because the patient didn't get it when they had the MRI or CT scan or whatever it was done before. But the other thing I've noticed is that a lot of providers are getting credit for the ordering of each unique test, which means each unique CPT code. And then we always look backwards to see if they tried to, get a review from something they already got credit for ordering. But the payer wanted us to look forward, which I thought was interesting. They're like, one thing we're wondering is, even if they said they were going to order these tests, how many tests actually got ordered? Well, this was an eye-opener. What we found, and this is a primary care practice that was kind of being questioned on this, we found that most of the tests that they were getting credit for, they only ordered a couple of them, not all 3 or 4. It happened a lot in urgent care centers as well, where the patient was coming in just for the flu and they had a standing order for 4 rapid tests. They did COVID, they did flu tests, they did, PCR, whatever, strep test. And I'm just like, oh my gosh, every single time the patient comes in, same symptoms. You can't have that. It has to be individual to the patient. But it turned out only a couple of those were actually being done and thought to be medically necessary. So they were getting credit for the moderate level of, any combination of 3 of review, prior external records, or review of the results of each unit test, or ordering each unit test, etc., instead of the low, which was a combination of 2. And then you find out later on that it was actually only 2. So the data upcoded when it shouldn't have been. So that's something that payers, and this was 2 commercial payers, are now looking forward, not just back at what did you actually do from what you said you were going to do, you said you were going to order, and what actually happened. So be aware of that I'm noticing a lot of data elements can be manipulated in a way that's not good, and we want you to make sure that you are doing things correctly, accurately, compliantly, and not kind of forcing someone to look forward to see if you are being truthful in what you actually did. The last thing I'll say on this, and this is something that came up, and it was a controversy on LinkedIn too, and I'm going to stand by my position on this. There was an ER doctor out there saying that if you ordered an EKG, you could also get an independent interpretation for reading it. Well, I disagree with that. The EKG is in the hospital, and it's being billed in the hospital globally, probably by that physician, but also by the hospital. And you're reading a report. Unless you are, actually doing this interpretation independently, I don't see it. So that, again, that's my professional opinion. The ER doctors may see that differently because they're taking liberties with some things, but be careful, because that could come back later on when it's really more you're just ordering an EKG and you're getting a report or a scan of that. You're actually not getting anything else specifically, and that could be considered a point of care test. So watch out for certain things that could really be maybe a trap. You don't want to do that. Okay, everyone. Well, I hope you are having a good May. We're already halfway through it. I know I'm just recovering. Got a little sunburnt in Hawaii, but it was a nice break to have, and it was very nice. My brother and my sister-in-law went with us. My husband and I went, and it was just a really nice break to have for a week. So everyone, make it a great day, make it a great rest of your week, and thank you for listening to the CodeCast podcast.
For more information on medical coding, billing, auditing, and compliance, including how to hire Terry, follow Terry on Twitter at TerryCoder1, or visit her website at www.terryfletcher.net. Podcast producer Joe Kuzma. Music producer Dassassin Music.